And we just went into a mode where we're getting these kids out, we're getting them safe.
What started as a garbage fire on Sunday turned into a rescue situation, and it wasn't because of that fire. Authorities say it was the living conditions.
11 kids are now in protective custody, and if it wasn't for that fire, the kids' living situation may have never been found. Good evening, and thank you for joining us for KREM 2 News at 6. I'm Mark Hanrahan.
And I'm Whitney Ward. We do want to warn you this story could be disturbing for some viewers. 11 children in total are now in the care of Child Protective Services. This after Spokane firefighters and Good Samaritans found those kids after responding to a fire in the East Central neighborhood of Spokane.
KREM 2's Amanda Rowley talked to witnesses who reported the fire. She shares how they helped the kids until help arrived.
You never know when you might be in the right place at the right time.
We shop at North Costco, to be honest, and we don't go that direction.
The Blackburn family found themselves right where they needed to be Sunday afternoon. They saw smoke from the freeway and went to check it out.
We ran in, we were banging on the door, and to get them out, and we didn't know who was in there.
A woman opened the door, and to the Blackburns' surprise, several children came outside.
At first it was 1, then 2, then 3, then 4, and so on until it was 11 children came out of the house.
What was going through your mind? I mean,
just to get them out, get them safe.
The Blackburn family told me they carried as many children as they could from the house and loaded them into their truck, turning the heat on blast to keep them all warm until more help arrived.
We put them right back in there.
They fit 7 kids in the truck, the remaining 4 warmed up in other nearby cars.
They had a baby, they had 3.
2 babies.
Just 1 sitting up there, 3 right here, a baby, a bigger girl was holding a baby, 2 more over there.
Spokane firefighters put the backyard fire out quickly. Then the Blackburns told the fire chief something felt off about the children.
Some of them weren't clothed correctly.
According to the fire department's report, crews described the inside of the home as a hoarding situation. Garbage, old food, and animal feces littered the home. Some firefighters described the children as malnourished and dirty.
We were all weeping.
Oh yeah, immediately broke down when we saw the kids.
The Blackburn family doesn't believe it's a coincidence they spotted this fire. They were right where they needed to be at the right time.
The oldest child said to me, God moves in mysterious ways, and she said she believes that we saved our lives.
Amanda Rowley, KREM 2 News.
Again, all 11 children now in protective custody. Spokane police say no arrests have been made at this time. We'll share more updates as the story develops.
And our other top story tonight is the weather. And it is calm out there right now, but we are expecting several more inches of snow across the inland northwest by tomorrow.
Let's get straight to meteorologist Tom Sherry. And Tom, when does this next storm hit us?
Well, we're going to get a little bit of light snow tonight, probably up to about 1 inch of snow in the Spokane area. But the big storm that we're talking about, where there is now a winter storm watch in effect everywhere you see shaded in blue, that will develop late Wednesday night after 9 p.m. and then continue through Thursday. And it's going to be wet and heavy snow towards the end of the day on Thursday as the temperatures warm up. Look at where the winter storm warning is in effect in the Cascades and the Yakima Basin area shaded in pink right there. At the highest elevations could get 36 plus inches of snow. I would not be traveling across the pass Wednesday night or Thursday. I would stay off that if you can do that. 4 to 6 inches of snow possible in the lower elevations across the Spokane area, northeastern Washington into North Idaho. Could get 8 to 12 inches of snow. Again, this is late Wednesday night into Thursday morning. Kind of hard to see right here, but this is Snoqualmie Pass. Still snow and ice on the roadway, and again, more is on the way. Roads are freezing up now locally. We've got a temperature of 30 degrees. Wind is out of the south-southwest at 8 miles per hour. There is snow or a rain-snow mix occurring in the lower Columbia Basin south of I-90 and now moving into areas of southeastern Washington. But as we zoom in on the Spokane Coeur d'Alene area, looking pretty dry at this time with just a few isolated snow showers. Over the next 3 days, it still remains cold overnight. 19 the low tonight. We'll see 18 the low into Thursday morning. Again, remember, Thursday's our big snow day. Wednesday night into Thursday. Friday just gets plain sloppy. Could be a rain-snow mix with a daytime high of 40 degrees. I'll check the weekend and your 10-day forecast next.
All right, Tom, thank you very much. The CDC now estimating the Omicron variant is responsible for 95% of circulating COVID cases in this country. Yesterday, in just one day, the U.S. reported more than 1 million new cases.
And we are starting to feel the impact here at home. The Spokane Regional Health District reporting 718 new COVID cases today alone. That is a huge jump from yesterday when the health district reported 203 new cases. 78 people are currently hospitalized right now with the virus. That's a jump of 11 new hospitalizations since just yesterday. Meantime, across the state line, the Panhandle Health District is reporting 163 new COVID cases today. 80 people are hospitalized with the virus. That's a jump of 19 new hospitalizations just since yesterday. Well, the Washington State Board of Health is considering adding the COVID-19 vaccine to the list of vaccines K-12 students are required to have to attend school.
The Mead School District right now is asking parents to let the state know how they feel about that possibility. KREM 2's Kyle Simchuk talked to one board member who said she does support vaccines, but not mandates.
Right now, there are 11 vaccines that students are required to have if they attend public school, including measles, mumps, polio, and chickenpox. Now the Washington State Board of Health is considering adding the COVID-19 vaccine to the list.
We're talking to lots of parents. There are a lot of people who are very concerned about this, and not just parents, grandparents, community members. There's a lot of people concerned about this.
Brianne Gray is a parent and Mead school board member. Gray says she's not against vaccines. She just doesn't want the state to force parents to make a decision.
What we're kind of arguing is a mandate for this. It's forcing parents to vaccinate their children, even though they don't necessarily feel comfortable with it. But they're being put in this position to vaccinate or not have access to education, and it's just, this is a totally unnecessary and terrible position to put the parents in.
The Mead School Board is now asking parents to comment on the issue by emailing the Board of Health no later than this Friday at noon. The district also sent a letter to parents urging them to take a survey on their thoughts on a COVID vaccine for students. Those comments will be part of the board's meeting next Wednesday when they could take action. Some board members argue the COVID-19 vaccine doesn't meet the same criteria for the 11 other vaccines school children are required to get.
I think that these feelings are elsewhere. I think you hear this and see this in different school districts, but I think we just have a great community, and I think it's our job as the school board to represent their voice and to stand up and let the State Board of Health know.
Reporting in Spokane, Kyle Simchuk, KREM 2 News.
In the meantime, Gonzaga University is requiring COVID-19 booster shots for all vaccinated students, faculty, and staff. Gonzaga said people must receive those booster shots within 14 days of becoming eligible. Students should update their status with that booster information no later than Friday, January 21st. Gonzaga also is requiring that all students, regardless of vaccination status, get tested 48 hours before returning to campus.
Providence's chief medical officer gave a stern warning of the impact that Omicron could have locally. He talked about a probable upcoming surge in cases.
Now, that surge could lead to increased hospitalizations, and as our Ian Smay explains tonight, the hospital is already at a tipping point.
Dr. Dan Getz said the impacts of the Omicron variant are compounding the already present staffing issues that hospitals are facing. If this new variant leads to a surge and hospitals continue to suffer staffing shortages, Getz said the state could be on the way to crisis standards of care. With early studies showing that the Omicron variant of the coronavirus could be 2 to 3 times more contagious than the original, Providence's chief medical officer, Dr. Dan Getz, painted a grim picture of what this could mean locally.
When you look at how contagious Omicron is, unfortunately, probably everybody's going to get a shot at getting this thing. And that's why it's so important to get people vaccinated and really protect themselves as much as they can.
Part of protecting yourself against the coronavirus is wearing a mask in public indoor spaces, such as grocery stores. But according to Getz, people are worn out when it comes to taking precautions against the pandemic.
We know many people are experiencing pandemic fatigue. Mask wearing in the Spokane area has really gone down. Stores can't enforce it, and this is not the time to walk around unmasked as we see this variant spreading quickly through our state.
The impacts of Omicron have also reached those working in healthcare settings. Hospitals have been facing a staffing shortage for months. Getz says this is made worse by staff members being sick with COVID themselves or being exposed and having to show a negative test to return to work. If a heavy spike in hospitalizations caused by COVID coincides with a large amount of hospital staff being sick, Getz said it could lead to dire consequences.
we're already at a point now where staffing is incredibly challenging. And if we see lots of ill calls and a high volume of patients, this really could drive the state into a crisis standards of care setting.
According to Getz, those staffing issues are also impacting how much testing Providence can carry out. He also said providers are not only dealing with a high amount of COVID patients, they're also treating other illnesses or performing surgeries that may have been delayed during previous surges. Getz also said high capacities locally also might impact how many transfer patients they can take from more rural providers. Getz also said that the one characteristic that most people hospitalized with COVID-19 currently have in common is the fact that they are unvaccinated. In the newsroom, Ian Smay, KREM 2 News.
Our coverage continues tonight on COVID-19 as we are seeing more demand for testing in our region. How the state says they are handling the increased demand for tests, plus the new guidelines you should know before you try to get one.
Also, a little later tonight, if you call the police in Boundary County, it may take a little longer for help to arrive. Why the department says they just can't readily respond to every emergency call right now.